Hello, Lions, District Governor, past District Governors, Vice District Governors, Region and Zone Chairs, family and friends. We thank everybody who has hopped in to hear our presentation at our first ever virtual 2021 District Convention. Lions New Voices, Women's Initiatives, is a district committee formed 3 years ago when the New Voices was introduced by our first ever woman president of Lions Clubs International. We have provided numerous opportunities for our members to have a voice and gain experience as presenters on numerous topics. Our presentation today is about women and the pandemic, beginning with some images reflecting the pandemic.
Hello, my name is Donna Morris. I'm a member of the Lions New Voices and Women's Initiatives Committee and the Toronto Beaches Lions Club. When COVID-19 hit Canada, women were affected in many ways beyond the virus, and the impact of the pandemic has not been gender neutral. Women have accounted for almost 2/3 of the job losses, despite making up only 50% of the workforce. Demands of caregiving, homeschooling, and work have skyrocketed. Risks of domestic violence have increased, and calls to crisis lines have surged. And women's mental health has been adversely affected, especially the mental health of our frontline workers. Today, we at Lions New Voices are going to share with you how the pandemic has had a disproportionate effect on women in terms of their employment, homework balance, domestic violence, their mental health, and that of our frontline workers. We will also hear what Lions can do to help. With every crisis comes an opportunity to build back better, and we as Lions can be part of that recovery. Our first presentation will be given by Ginny Wong, who is going to address women's employment during the pandemic.
Hi, I'm Lion Ginny Wong. My topic is women's employment during the pandemic. Women around the world have been deeply affected by the COVID-19 pandemic. Women have suffered more job losses than men. There is a sharp reversal of the gains women made in the labor market before the pandemic. This has been dubbed by the economic expert as the she recession. Most of the job losses have been in the retail, services, hospitality, and entertainment sectors, which are female-dominant and most vulnerable to lockdown measures. While all women have been impacted, three groups have experienced the largest challenges: working mothers, particularly single mothers, women in senior management positions, and Black women. This chart shows the job losses by sectors. Job losses by women is represented by the yellow line. As you can see, job losses in accommodation and food services and other services have been impacted women the most, while it is at par at retail and wholesale trade. From this graph, overall, we can see the job loss in women is 10 times more than that of men since February 2020. Restrictions in service jobs and the closure of schools and daycare facilities have forced many women to quit their jobs and return home to become homeschool teachers and full-time caregivers. This becomes the motherhood penalty. Many working mothers have had to give up paid employment or walk away from their own business to focus on the family. Now they have added responsibility of homeschooling their children as schools and daycare facilities have closed. Many women are also looking after elderly parents who have left long-term care facilities and returned home to be safe. A study of Women in the Workplace 2020 states, despite companies' efforts to support employees during the crisis, women are feeling more exhausted, burned out, and under greater pressure than men. According to the RBC Economic Report, nearly 100,000 women aged 20 and older have exited the labor market since February 2020, compared to fewer than 10,000 men in the same age group. 10 times more women have left the workforce than men. 12 times more mothers than fathers quit their jobs and returned home to look after children when schools and daycares closed. A survey from McKinsey & Company interviews of more than 40,000 workers across North America between June and August 2020 reveals 1 in 4 women are considering leaving the workforce or downshifting their careers versus 1 in 5 men. This disparity was particularly stark amongst parents of children under 10. The rate at which women in this group were considering leaving was 10% higher than that for men. Women in heterosexual dual career couples who have children also reported greater increases in their time spent on household responsibility since the pandemic began. A COVID-19 caregiver survey conducted by Boston Consulting reports 60% of the parents have no outside help on educating and caring their children. Parents spend 27 more hours a week on household chores, childcare, and education. Women currently spend 15 more hours a week on domestic labor. And close to half of the respondents feel the performance at work is suffering because of the additional responsibilities from home. The issue of women leaving the workforce will have a long-term economic impact beyond the pandemic, and its effort is being dubbed as the She Recovery. PricewaterhouseCoopers has warned of the need to take action on women's unemployment globally. Unless countries address the efforts of the pandemic on women, more women will permanently exit the labor force, setting back their workforce gains by decades. OECD, an organization for economic cooperation and development with 37 member countries, including Canada, has warned that even at double the rate of historical progress, women will not catch up to the pre-pandemic equality growth path until 2030. OECD also states, the longer women are out of the labor force, the greater the risk of skills erosion, which could potentially hamper women's ability to get rehired or to transition into different roles as the economy evolves. Now, what can Lions do to help? Beware of the She Session effort and be proactive on the She Recovery. For Lions as employers, if feasible, help create job opportunities for women and make a conscious effort to hire women and consider hiring them for leadership and management positions. Get involved to design and offer training programs for women going back to the workforce during or after the pandemic. Advocate to our MP for additional funding from all levels of government to provide affordable childcare. Donate to organizations that help families in need. And help out your neighbors if you know their situation. For example, help them get groceries, cook them a meal, bake them a cake. This will cheer them up and help relieve some pressure. And be empathetic. Do not judge your coworkers if you hear children yelling, babies crying during work Zoom calls. And if you are a partner at home, be more understanding and help out and share the household duties as much as you can. Thank you.
Hello, everyone. I am Lions Crystal Wong from Leaside Centennial Lions Club. I will talk about two other impacts related to employment on women, food insecurity and housing insecurity. With COVID surging, that has imposed a hard hit on economy and caused massive layoffs and unemployment. Women are mostly employed in many of the industry hardest hit by COVID-19 pandemic, like food service, retail, entertainment, and hospitality industry. One of the statistics shown that 89,000 women work in the Canadian food service and beverage sector in the fourth quarter of 2020, which is down 33% from the first quarter of 2020. Women have lost jobs at higher rates than men and faced with higher rates of poverty and food insecurity. Women have been disproportionately affected by unemployment, poverty, hunger, and housing problems during the COVID-19 pandemic. According to statistics, 1 in 7 Canadians experiencing food insecurity during the pandemic. Food insecurity is defined as inadequate or insecure access to food due to financial constraints. This is done in a report released by the nonprofit organization Community Food Centers Canada. Before the pandemic, an estimate of 4.5 million Canadians experienced food insecurity. During the pandemic, food insecurity has increased across the country. According to Food Banks Canada, before the pandemic, more than 840,000 Canadians sought help from a food bank every month, and there has been sharp increases in usage in 2020. CEO of Toronto's Daily Bread Food Bank, Neil Harrington, told CTV interviews that the city has seen a 200% increase in the number of new food banks users. The COVID-19 pandemic has forced Canadian food banks to get creative in their approach to giving out food and collecting donations. The federal government had doubled the amount of pandemic aid for Canada's food banks by adding another $100 million to the Emergency Food Security Fund. The food banks and money from the government have helped struggling Canadians put food on the table during COVID-19. Neil Harrington, the CEO of Toronto's Daily Bread Food Bank, said in an interview that often it's said that food insecurity is not a food issue, but an income issue. So as we look towards the incomes that individuals have across the country and the challenges of expenses in big cities, in particular like Toronto, that income statements doesn't add up. Harrington is calling on the public to advocate for positive social policy that would include affordable housing and the implementation of a national anti-poverty strategy, so Canadians can emerge from the pandemic much better. So now let's look at how Lions can help on food insecurity. We can actively participate in donations of money, small or large. Also actively participate food collections in our communities. We can promote teaming up Lion clubs together to get involved in these activities and become more effective. We can advocate the need and drive governments of all levels for the implementation of a strategy to eliminate poverty. As suggested by Mr. Harrington during an interview, our suggestion is that we take on the advocacy role, we pick up a pen, and we write a letter to or send an email and advocate for the change to our MPs that we need to see. Now let's look at the housing insecurity situation. COVID-19 is worsening homelessness and insecure housing for women. The term housing insecurity refers to conditions that are challenging, such as poor housing quality, overcrowding, unaffordable housing, and homelessness. In Canada, it is estimated that 12.7% of the population experiences housing insecurity. Before COVID-19, there was already a profound lack of safe, affordable, adequate, and appropriate housing. Supportive housing programs and emergency shelter programs for women, girls, and gender diverse people in Canada, especially in jurisdictions with high rates of gender-based violence. During COVID-19 pandemic, women, girls, and gender diverse people are significantly impacted by loss of income due to unemployment, and that has put women-led households at great risk of losing their housing. There are reports and research done by the Women's National Housing and Homelessness Network and the Community University Policy Alliance on Women's Complex Homelessness at McMaster University. They both reveal multiple pressures on women, girls, and gender diverse people as they struggle to find or retain safe shelter during the pandemic. Housing support services, including outreach and housing first providers, have adjusted the ways how they provide support to clients to maintain their tenancy during the pandemic. When policy put in place to support moratoriums on evictions during COVID-19 are lifted, there will be an increase of women-led households entering into homelessness. The lack of housing and emergency shelter is intensifying as a result of COVID-19. Also, to adhere to social distancing guidelines, many emergency shelters across Canada have been forced to operate at a lower capacity. The COVID-19 pandemic has created unprecedented challenges that are affecting housing, health, and social welfare policy across Canada. The use of hotels and the conversion of spaces into temporary shelters have offered appropriate short-term solution to housing issue of the vulnerable groups during the pandemic. So government should recognize the value from the short-term housing solutions in response to COVID-19 and the need to establish more permanent housing for individuals facing homelessness in the future. One of the challenges is for all women, girls, and gender diverse people to have access to safe, adequate, and sustainable housing. So how can Lions help on housing insecurity issues? We can participate to collect donations of useful and necessary household items for setting up the living quarters for the homelessness. We should advocate the needs to provide adequate housing assistance from all levels of governments, like increase emergency shelters as short-term solution, increase affordable housing to have safe, adequate, and sustainable housing for women, girls, and diverse people. Again, we need to advocate the needs of our governments of all levels to implement a strategy to eliminate poverty. More so is that we need to recognize how inequalities affect health and how important for us to build a healthy society during recovery from COVID-19 pandemic. Thank you.
Hello, everybody. My name is Phoebe Kagumba Sibanda, and I'm a Lion from Mississauga Cooksville Lions Club. I'll be reading about frontline workers. Frontline workers continue to be our heroes during this pandemic period. They have been going to battle without the option of working from home, like many of us can, and many have faced the brunt of this pandemic upfront. As per the World Health Organization, 7 out of 10 global health and health service workers are female. World Health Organization official Hans Kluge, at a virtual news conference held in early March 2021, noted that health workers account for 8% of global COVID-19 cases, and the risk they run of getting infected is more than triple the risk of most of humanity, the ones they are trying to protect. 5 weeks ago, out of the 1.3 million health workers that had been infected with COVID-19, 68% were women. We must do everything in our means to protect our frontline. It is fundamental, an obligation of every government to assure vaccination of the health and social workforce. That is a quote from Hans Kluge. Dr. Charlene Sharif, a McGill University researcher, states that the pandemic has disproportionately affected women, our she heroes, working in the front line. He states young women in the medical field who may have young families are exposed to the virus to a much greater extent. To quote Dr. Shaheen Sharif, many of the frontline workers are from marginalized socio-economic groups where they are living in crowded areas. They can't get away from people. They can't isolate. Many of them have to take public transport, end of quote. Young women doctors going to work on the front line are fearful. And even though some may have been vaccinated, it does not take away the fear. This was mentioned in an article from CTV News on how women have been particularly affected by the pandemic. Lions continue to provide support in service to our frontline workers. Many clubs have raised funds to purchase food items and water for frontline workers in their respective communities. In District A711, we have a member of Mississauga Central Lions Club, Lion Lynn Friedman, who has diligently stitched and donated face masks for our frontline heroes. She takes donations in kind, in terms of material or stitching items to facilitate this ongoing and admirable project. Here we have a few pictures of the admirable work that she has done. And these donations are made to frontline workers at the hospitals within our communities in Mississauga. What can Lions do? What can we as a community do to ensure and make it much easier for our frontline workers? We should stay home, get vaccinated as a priority where possible, and adhere to all protocols, which we should all know by now. We should also continue providing that refreshing support to our frontline workers where possible, as already mentioned. Thank you.
Hello, I'm Donna Morris from the Toronto Beaches Lions Club. I will be talking to you about women's mental health during the pandemic, and will be delivering a presentation jointly prepared by Santosh Bhagat and myself. A recent survey conducted by the Association for Canadian Studies reported that the pandemic has adversely affected women's health more than men. According to the results for the age group 18 to 34-year-olds, 36.5% of women reported their mental health was bad or very bad, compared to 26% for men. This marks a 10.5% difference. For persons 35 years old and older, 19% of women reported their mental health was bad or very bad, compared to 14% of men. Again, a difference of 5% for women. The highest levels of those reporting that their mental health was bad or very bad is seen amongst the unemployed, with women reporting 43.7% feeling bad or very bad, compared to 28.2% for men, a difference of 15.5% for women. As we heard from the previous presentations, these numbers are not surprising, as on the whole, women have been more adversely affected by the pandemic. In a recent CTV News report on mental health, which aired on March 15, 2021, women were reported worsening mental health, and this was especially the case amongst working mothers. The survey found that working mothers were much more likely than men to experience feelings of stress, anxiety, depression, and insomnia. 50% of women felt stress, 47% felt anxious, and 43% felt depressed. Many working mothers feel trapped by lockdown restrictions and the extended stay-at-home orders, and they're having to manage ever-changing restrictions, which change almost daily. Some have wondered really how much they can take. These alarming levels of despair have led to an increase in the use of drugs and alcohol, an increase in suicidal thoughts and feelings. 1 in 10 Canadians, that is 10%, have experienced thoughts or feelings of suicide. This is an increase up from 2.5% pre-pandemic. There has also been an increase in the number of suicides. The suicide mortality rates among women have increased due to isolation, social distancing, and loneliness. Stress felt from job loss, food insecurity, and housing insecurity. Barriers and lack of access to mental health treatments. Decreased access to community and religious supports. Excessive work-home stress as women struggle with the demands of caregiving, homeschooling children, worrying about the health of family members, elevated stress amongst medical professionals, many suffering from post-traumatic stress disorders, and an overall national anxiety as the number of COVID cases and mortalities increase. How can we manage this increased anxiety and stress that we are all feeling? Here are some tips. We can acknowledge that some fear and anxiety is normal. We can switch off technology and do something enjoyable. Read a book or exercise. We can get outdoors. We can limit our news intake, including that from social media. And we can get our news from reliable sources, such as the World Health Organization and Health Canada. We can show compassion and check in on our neighbors and those at risk. We can stop buying excessively. Hoarding behaviors are common in times of uncertainty. Recognize this. Seek mental health services from the Canadian Mental Health Association and the Canadian Addiction and Mental Health Association. Other things we can do is we can eat a healthy and balanced diet. We can practice good hygiene and good sleep hygiene, aiming for 7 hours daily. Establish a daily routine. Exercise a few times a week. Do yoga, practice meditation. Plan family workouts, walking and biking together. Engage in a sense of meaning and purpose or accomplishment. Set goals for yourself each day. Learn something new, a new language, a new skill, or new hobby. Read books or listen to audiobooks. Practice mindfulness. When we are in a place of uncertainty, the most effective way to decrease worry and anxiety is to be fully present in the moment. How can Lions help? We can stay connected through service. We can send a word of gratitude to frontline workers who are working through this challenging time. We can volunteer to distribute PPE to the community, retirement homes, and long-term care homes. We can donate food and other household essentials. We can also stay connected with family, friends, and neighbors by phone calls, online, through social media, video chats, or mail. We can check in on people and see how they're doing. And we can ask if we can help in any way, run errands. And we can also stay safe, wear our masks, and get vaccinated. Thank you.
Hello, I'm Carol McCaig from the Leaside Centennial Lions Club, and my topic is violence against women and children during the pandemic. Crises are a catalyst for gender-based violence. Gender-based violence is a predictable and consistent side effect of economic, epidemiological, and environmental crises such as COVID-19. Stressors relating from social and physical isolation, employment interruptions, and financial pressures lead to increased conflict in the household. It may also lead to risk factors that are associated with higher rates of child abuse and intimate partner and sexual violence, such as alcohol use. Lack of communication, that the services remain open to those in need, and the misunderstanding that they're closed has put victims at greater risk. Media can help by ensuring the message is conveyed that the services are still available despite the lockdown measures in place. It's crucial that comprehensive funding is in place to ensure adequate support for individuals experiencing gender-based violence before, during, and after the pandemic. Perceptions of risk and changes to health and social services may leave some individuals with fewer options for reporting or escaping the violence they experience. Imagine being turned away due to being misinterpreted as not in great enough need, and or possibly due to lack of space, as was the case during the pandemic and is still a case, and decisions as to who got space and who was perceived as not being serious or needy enough. We all have heard too many times what can happen when a victim and or their children has no choice but to return home to their abuser. Inability or uncertainty about assessing medical, police, court, educational, and crisis services during COVID-19 or any pandemic may prolong a person's exposure to violence or delayed access to treatments for violence they have experienced. It's imperative that we learn from this going forward and maintain the lines of communication so that victims are secure in knowing they have the resources to turn to in a time of need. This can prevent further abuse or worse, death. The Canadian Women's Organization created a campaign because they knew the risks to victims were rising and needed a way to help women who needed it most. They knew they were at higher risk due to the lockdown and afraid their abuser would catch them trying to get help, and needed a way for them to alert people about their situation, for example, via a Zoom call. Did you see the TV campaign last April? It spread throughout Canada and into the US before spreading throughout the world. This is the signal that they came up with to help women alert that they needed help. So it's the palm to the camera and tuck the thumb, trap the thumb. So this is the violence at home signal for help. The Ontario Association of Interval and Transition Houses 2021-22 provincial budget submission posted on January 29th, 2021. They call on the Ontario government to move from funding enhancement to funding stabilization. When women's shelters are unable to respond due to lack of bed space, or when another safe alternative cannot be secured, it can mean the difference between further abuse or being killed. The demand for services far outweighs the funding received to deliver these services. Investing in community-based services will reduce government expenditure in costly systems. We know these are increases in crisis calls to shelters, as well as more serious and frequent instances of violence during the pandemic, said Anurad Dugal, Vice President of Community Initiatives at the Canadian Women's Foundation in Montreal. We need to shift the culture so men are responsible to each other and themselves and understand exactly that they are more responsible for this violence than anybody else, and they need to take responsibility for that, she said. Men can ask for help, she said. They can be strong enough and courageous enough to ask for help when they see things are getting out of hand. Prevent further increases of femicide, which is the killing of women and girls because they're females. So, how can the Lions help? Well, by supporting any of the women and children's shelters listed on the following page. Volunteer, donate clothing, food, etc., hold fundraisers, team up with other clubs to help. Be attentive by watching out for what's going on. Be on the lookout for the symbol that I mentioned above, asking cautiously if they need help. Are they okay? Do they want you to help? Ask, do you need a doctor? Do they need you to call the police? Maybe you're a friend of the abuser and know what's going on and possibly recommend some counseling for them. This would go a long way in reducing the future risk and escalating circumstances. And last but not least, get your vaccine and help and bring our lives back to normal. And then I have this page which you can copy down. They're all links to women's organizations that need volunteers or financial donations or all of the other things that I mentioned earlier. So, thank you, everybody. This comes to the end of our presentations, and I would like to say that thank you for staying with us throughout our presentations, and hopefully you gain more insight into how women have been impacted disproportionately during the pandemic and got some new ideas of how Lions can help some of the many women's causes and organizations who are there to serve our communities. We hope you report back to your clubs on some of the ideas you gained, or they will complement projects you're already doing to serve your community. And thank you to my team for participating on the committee and being so collaborative and putting this together. And so that means we are now down 2 and 1 to go for this Lions year. Way to go, everybody. Cheers. Thank you very much. Great job.